Welcome back to the Moms Interrupted podcast.
We're your hosts, Taylor and Natasha.
Between us, we're moms of two raising little ones with backgrounds in lactation counseling, childbirth education, and doula support.
But more than anything, we're two moms figuring it out in real time, just like you. So reheat your coffee, get comfy on the couch, and join us every Thursday morning.
This is Moms Interrupted. Hello, everyone.
Good morning and welcome.
Welcome. So really quick, I can confirm that 3 months is more difficult than the newborn stage.
Once your baby is sleeping and then they start waking up again, I think that's worse than consistently waking up all night. Once you're used to sleeping and then they start waking up again, you're like, oh no.
Yeah, you're like, go to bed.
Like, why are you?
I know you can do it.
Right.
Why aren't you?
That was always the frustrating part for me. I know you can do it.
Yes, because when they're a newborn, you're like, oh, you can't do this.
No, you can't.
You're not capable.
Yeah, so it makes
And then
sense.
they start being capable and you're like, why aren't you doing this?
Excuse me, do you hate me? Are you trying to torture me? Yeah.
So I didn't sleep last night.
I'm so sorry.
That's okay. I still love her.
Yeah, of course. Just like also go to sleep.
Go to bed.
Yeah.
So 3 months, harder, hot take. Yeah. So not, I think everyone agrees. Or I don't know. Let me know.
I think not everyone agrees because, of course, there's cases of colic and other things. But I think for a baby who doesn't have a diagnosed medical condition, of course, there's temperament and all of those things. But I will die on this hill that like the 3-ish, 4-ish month phase when the adrenaline has worn off and you are beat down. That's when it gets real. And the baby starts being awake more in the day. So you don't just get to lay.
I wonder if listeners, let us know, listeners, if you can tell that Natasha and I are incapable of having a conversation where we don't state like all the angles because we're educators. So like,
right.
we're like talking about, you know, something that could be said really simply, but we're like, but it's nuanced. There's temperament. There's niche cases where someone could have colic or someone could have, you know what I mean?
Yes.
You know what I mean? That was just a thought that came into my head. It's like, you know,
yes.
we're incapable of, which is a good thing.
Well, yeah, because like it's not black and white.
Yes.
And we'll be the first to say it.
But I saw something recently, and now I have so much to say. A lot of people in the baby space, are now saying colic is not a diagnosis, it's a symptom.
Colic is by definition a baby cries for more than 3 hours a day, at least 3 days a week for over 3 weeks. That is a symptom of something that's happening that could be diagnosable.
I hear a lot about cranial sacral,
chiro,
all these different
GI,
things.
Reflux, like all kinds of things are going on.
Lactation specialist. Yes.
All kinds of things are going on.
Yeah.
And we're just like, oh, they have colic. Push through. Wait till they get a little bigger.
Right.
And there is purple crying. Babies do have a peak age where they cry the most and then it goes down, right? There's a curve. But many times there are things that you can do to help. I think changing the verbiage around it.
Yeah, and giving pediatricians the correct referrals out.
Yes.
Because I'm sure these moms are telling their pediatrician, like, this is happening.
Of course.
So to me, that's the middleman that needs to funnel out. Anyway, that's a hot thought.
Yeah. Hot thought.
Okay, so today we are going to be talking about birth throughout the ages, which is one of my favorite subjects. So for people who don't know, there has been little to no inventions in the last few decades.
Right.
And recently there is.
This new invention.
This new invention is called the OdonAssist.
Okay.
It was invented by a car mechanic. And
how does that happen?
This is seen as the gentler version of forceps and vacuum. Okay. And actually, the research is very promising that has been done so far. Men who have been using it and opting for it in practice are liking it. So this is good.
Okay.
And it is shown to be more gentle. Well, one, when we first saw it, Natasha and I, we were like, why is there a plastic bag over a baby's head? Like, what is happening here?
Yes.
Is this the best we could do?
Right.
It took decades for us to create this. The lack of women's studies, like this is crazy.
This is great. So this is what I was saying. 2 things. 1, how does a car mechanic get involved in birthing babies? Like, where is the career pivot there? 2, how is this our best and latest and greatest invention? Like, we are on the moon, we are doing all of these incredible things with technology. And look, I don't know anything about it. I'm not a doctor, I'm not a researcher, but how is it that we are inserting a plastic bag into the vagina when the woman is trying to birth this baby, and said baby is quote unquote stuck? We are inserting a plastic bag, wrapping it around the baby's head, and then tugging the baby out.
So what I will say is this is clearly an alternative, right, to forceps and vacuum.
Okay.
Which, if you look at videos of that, you're kind of like, as well.
Yes.
To be fair, you know?
For sure. It's
so
barbaric.
Yeah.
It's barbaric.
So this should not be used in normal, low risk vaginal delivery.
Yeah.
It should be when complications arise. Mm-hmm. But my biggest takeaway from it is like, damn, this took so long to create. It seems fairly simple. What's happening here? Why isn't more being invented in women's health? And it really brings us to the bulk of this conversation today is like, look at all the things that have happened throughout birth history that are so shocking.
Right.
And it really makes me think, if it were men birthing, would it have taken this long to be progressing into inventions that are helping us, saving a lot of complications and pain and suffering that women have endured throughout the ages?
I mean, it makes sense, right? Because like women couldn't even have their own bank account until the 1970s. And so, of course, there's not a lot of research in women's studies because women weren't even able to contribute. It's amazing, right, what women have done. And obviously we have proven that we should be in these fields.
Right.
But we still have a lot to do. And I think that women are amazing for spearheading all of this research and all of these inventions.
Or car mechanics.
Or car mechanics.
Male car mechanics. Shout out to the male car mechanic that invented this.
I just need more information on that. I need to know how, why.
Anyway.
That's all I have to say.
Okay.
Okay, so this is Taylor's forte. Like, this is where Taylor thrives. And I'm also a history nerd, and so I'm super curious and interested, but I can't wait for you to just bulldoze us through, because there's so much crazy stuff.
This is one of the first things that you learn when you want to be a childbirth educator, because it's so important, if you want to talk about today's landscape with birth, to talk about where we've come from. And so much of the things that have occurred throughout birth history have been drastic improvements, and they've been very positive. Of
course.
And there's been a lot of things that have happened that are a little more interesting.
Which I think happens in all aspects, all different fields. We have technology and amazing things happen, and then we're like, oh, maybe we need to edit how that went down or the way we do this. And so birth is not any different.
Yeah. I mean, lobotomies.
So the first thing I have to say is that typically it takes on average about 10 years for evidence-based research to make its way into medical practice. And my example of that was lobotomies. Lobotomies for years were recommended. They were the gold standard of care. There is a documentary coming out on Rosemary Kennedy, who famously was given a lobotomy. In the 70s, they stopped performing lobotomies because they came out with new drugs that were less invasive and had better results. And the reason why it was recommended for Rosemary Kennedy is because she was having behavioral issues, which, if you know anything about the history of just women's rights in general, you know that back in, this is not that long ago, you guys, like 75 years ago, husbands, fathers, grandfathers could lock up women in institutions because they were hysterical or they were having behavioral issues. So when Rosemary Kennedy was 23 years old, her family decided that she needed a lobotomy. And we don't have a lot of information on what her behavioral issues were or what her quote unquote outbursts were, but she was lobotomized and she was no longer able to function as an adult anymore after that. And she was put into an institution where the Kennedys hid her, and she was no longer around the family, and she died in her 80s in that institution. after being there for about 60 years. So that, all to say, that was a standard recommended medical procedure that was performed. It was new technology. It was modernization. And it was supposed to be a cure for behavioral issues, anxiety, depression, psychosis, schizophrenia, all of these things that we now have drugs for.
So, easy segue from that is that birth has only actually become medicalized in recent years. So if we go all the way back to the beginning in ancient times, we got a lot of questions. A lot of people were interested in who used to be present at births. Throughout history, at the beginning of ancient times, birth has always been a women-led event. There were always midwives. Women used to choose who they wanted in their birth and would invite people from their circles to join them. Just some fun facts. Ancient Egypt had birth goddesses. Ancient Greece had dedicated birth midwives.
Do we know what were the requirements to be a birth goddess? Because
No, I would be one.
You would definitely like to be one, and
birth goddess,
and I aspire to be one.
Fun fact, Socrates' mother was a midwife. It's key to point out this wasn't chaos. This was thousands of years of accumulated generational knowledge. You know, obviously we'll talk about the improvements in birth that helped, such as, you know, we didn't even wash hands till like the 1700s. Whoa.
Right.
And the history with that is some obstetricians were noticing that doctors were going from performing other types of surgeries and doing
autopsies,
things like that, straight to births without washing their hands. And women were dying.
Yeah. Because of the contamination.
And it was laughed at.
Right. When
it got ignored.
When they proposed hand washing between patients.
Yes.
It was like scoffed at. You learn about this all in infection prevention and science college courses, but it's crazy to think about that. If you asked someone in the healthcare space to wash their hands, it was offensive for them to suggest that they were dirty.
Some of the biggest changes in health history in general, but in birth history specifically, was hygiene and antibiotics. Those are two breakthroughs that we want to applaud.
Which is crazy because hand washing, like, so easy.
So easy.
Right. Because that goes back to germ theory and people didn't know about germs.
So as we mentioned, birth was historically very female led. In fact, it was frowned upon to have fathers in the room and even physicians in the room.
Back when?
So in 17th century England, the people who attended a birth were called the gossips.
Ooh.
And you would invite neighbors, friends that you respected and wanted at your birth, midwives, all of these different people. And it was called the gossips, which I love.
I want to be a birth gossip.
These people would help the midwife by making food and anything the midwife would need to help, which I love.
Like
a doula.
Yeah.
It's a doula.
It's a doula.
The doula has been around without being called the doula for ages.
Right.
Ages.
And midwives before that.
Yes. And I think about all the time, a doula is someone you are hiring because we've lost that.
Right.
I'm not just inviting Natasha to my birth anymore.
Right. And we no longer just like pitch in like that.
Which, by the way, normalize having some friends help out in birth.
Totally.
Why not? You know, hot thought.
Yeah.
So men were actively excluded until the 1700s.
I mean, that feels right.
One documented account describes a male physician in 1658 who literally had to creep in on his hands and knees to observe and examine the patient, then crept back out.
Stop.
Women did not want men to be involved at all. So that's interesting, right?
I mean, that feels right to me just as a woman.
Right.
When I think about the care team that I want in birth, even if I'm not giving birth, but someone who's performing an exam on me, I would prefer it to be a woman.
Totally.
In lactation, like if someone's doing a breast exam, prefer us to have the same parts. It just feels right. I know you can learn about it.
Totally.
I'm not saying you can't.
It's interesting how much I loved my male OB though.
Yes.
Who would have thought that I would pivot from midwifery care to a male OB? Like that, the arc there for me was not seen.
The shock of the century.
My mom was like, huh?
Right.
Anyway, shock of the century.
Yeah.
So birth became more and more private as the medical world took over. It became a lot more behind closed doors.
More shame.
Less people, more shame, more men, less women. And if you think about who was present at both, it makes sense that once birth moved from being communal to privatized, that the requirements for pain relief would change. Because when you're supported by all of these different female figures and doulas and midwives that are helping you with comfort, and the data clearly shows doulas decrease pain and increase satisfaction in birth by tenfold. It makes sense that when we removed those types of figures within the birth world, that we would need to discover and invent different types of pain relief.
Because it becomes more scary.
Yes.
You're more alone, and that's more scary in and of itself. And I would assume, I don't know, but I would assume that increases pain. Of course, I'm not saying that giving birth prior to
was fun.
Like it was fun, or it was or it was not painful.
Well,
I'm just saying I could see how if you have a group of women who you feel is taking care of you, who's giving you all of these tips to support you, who's helping you with pain management, that would be less painful. And all of these women have years and years of experience helping other women. I would assume that once you move to a hospital that's sterile with a male physician and people poking and prodding at you and not helping in the same way, like emotionally, that it would be more painful, and we would then medicalize the solution for pain.
Right. And what I do want to point out is a lot of the pain relief that we have today and the pain relief that was invented throughout time in childbirth was actually female led. We always talk about this, but there can be two things true at once.
Yeah.
As we are inventing these new things in childbirth, what is sad to me is we are losing the old ways. The pendulum swings. Instead of it coexisting together, one thing that comes to mind is OBs are not trained the way midwives used to be in specific types of vaginal births, such as twins or breech or all of those things. We're kind of losing the ability to do that and perfecting the C-section, which should be perfected and should be invented.
Of course.
But at the same time, we are losing some of the generational wisdom that midwives have to be required to be trained on.
Right. It's like one came in and the other went out, when it feels like it shouldn't be or, it should be and.
Yes.
Yeah.
And I think that is a big theme in birth history. One thing is invented and other things are lost. We did get a lot of questions on what was used before the epidural, because now it's like everyone just thinks epidural. Right. What else was used before?
Well, and that's like your only option. When people talk about pain relief in the hospital, it's just the epidural. It's not talked about what the other forms used to be, or what they
could be,
because, or what else is out there.
Yeah. In other countries, laughing gas is still used, nitrous oxide, and it's really not.
The UK.
Yes.
It's very widely.
And it's not really used here, and it's pretty effective.
Yeah.
So that's really interesting. But prior to that, it usually was tinctures, home remedies from midwifery care, and opium was one of the most widely used and effective.
Right.
And then it starts to get into the,
crazy.
Crazy. And then it starts to get into other things like chloroform.
Right. And then we get into
some crazy shit.
Right.
Like Twilight sleep.
And this is when men entered the chat.
Yes. Men now enter the chat, and things are starting to get cuckoo bananas.
Things are starting to get crazy. We've medicalized birth. We're pushing women and midwives and support teams out, and men are coming in and they're inventing things, sort of like this car mechanic.
Yes. So now men have entered the chat.
Yeah.
Do you know how forceps were invented?
Do I want to know?
The Chamberlen family invented forceps in the late 1500s England, and it was kept a secret for generations. They would bring a large box to deliveries and make everyone leave the room so that no one could see the instrument. They profited off of keeping life-saving technology hidden for decades. The Chamberlen family were man midwives, in an era where birth was becoming a paying profession for physicians, and their forceps gave them something no one else had. They would literally clear the room when they were utilizing forceps, and they sometimes would even blindfold the women giving birth so they couldn't see the tool.
So the woman couldn't even
Yes.
see what was going on to their own bodies.
Yes. So this is the
Awesome.
history of forceps. And clearly they are utilized and
Can be
can
life-saving.
be. It's been shown through data and evidence now that they are being overused. But
Right.
that goes to for a lot of inventions,
Yes.
in birth.
If you have not seen a forceps before, it looks like a giant salad tong.
Oh my God.
And it is inserted.
When I see tongs like that, I think of forceps. I can't not.
It's inserted into the vagina. And just think about this before epidurals. No.
You know what? Yeah, no wonder women are, starting to fight for in the same time more pain relief options.
Of course.
Of course. Owie.
I saw that you wrote on our outline something about chainsaws.
Did you know that before chainsaws were used to cut trees, they were used to cut pelvic bones
While you were alive?
during childbirth?
On women who were alive?
A lot of things done throughout birth history, such as the cesarean section, did not used to be performed on live. It unfortunately was when women had passed
away to get the baby.
and then
Still.
it became safer and safer, and obviously everything improved, technology improved, sanitation improved, stuff like
Yeah.
that. But yes, a chainsaw used to be used.
I mean, if you have ever been in a lab and dissected cadavers, which unfortunately I have, a bone saw, which I would think is like some sort of iteration
It
from
is. Yeah.
it's a chainsaw.
It is.
I can't get that out of
And
my
a lot
brain.
of the history sites that talk about this chainsaw are like, I know it sounds very barbaric.
Yeah.
Which it does.
It is.
It's shocking.
Yeah.
But people were doing what they could at the time to improve safety.
Yeah.
And it was shown to have less damage to tissues than a knife. So at the time.
So women were alive.
Correct. When a baby was stuck in the birth canal, it was invented to cut bone to widen a laboring woman's pelvis. So here's my question.
Well, I'm sorry. I need a second.
Here is my question. And, the studies back then weren't the same as they are now. So here's my question. All of the different techniques we know now to widen the pelvis that midwifery care does, were those not being used first? And was this the first? It just gets my mind wheeling because obviously these tools are so necessary in some circumstances.
I would argue that a chainsaw is not necessary in birth. I would argue that. That would be my number one argument.
So we've gone from the chainsaw to the OdonAssist.
I mean, I'll take it.
The arc. It's all
Obviously
so
the
interesting.
chainsaw, maybe that was
A
I don't know.
breakthrough at the time. That's what this history article was trying to.
It's just crazy because with these technological breakthroughs, the lobotomy, the birth chainsaw, I mean, all of these things, it's like, yes, there was good research that came out of it, but the women who endured it and then people were like, oh yeah, that wasn't such a good idea. It's just so awful. There's no words.
I know. It just feels like women are guinea pigs in birth.
I mean,
When
they
you look
are.
back at the.
They are.
Yeah.
Yeah. I would like to think that in our modern society, we are no longer guinea pigs, but
We are.
we are.
Correct.
And I understand that some of that needs to happen. We need to have trial and error. The chainsaw thing is just something I can't rectify. Okay, so men are chainsawing women. And then what else are men doing in birth now that they've taken over and pushed midwives out?
So it wasn't until the late 1800s that obstetrics became a male-dominated specialty.
Okay, so after the Chamberlen family with this forceps, after that, things started to get more and more male-centered in birth
Yes.
because of profits, right?
And yes.
They were like, this is a profession and men are taking over.
Yes.
Okay.
And in fact, there's a historical 1910 Flexner Report that the whole goal was to abolish midwifery care in the United States. And the sentiment around it was midwifery care is not clean, safe. You're endangering yourself, basically. And actually, there's really crazy flyers.
Smear campaigns against midwifery care, which I'm sure were racist and sexist.
Now it is known that these were racist and sexist reports.
Of course.
And a lot of the midwives at the time, especially in America, were Black midwives called granny midwives. And these were the women that were being pushed out of their profession. And at the time, midwifery care actually showed more promising numbers in terms of safety.
But it's about profits and men profiting and being in control.
Yes. And I think that birth is so interesting because it is such a nuanced conversation, right? Because so many of the things that were happening were improving lives, and so many of the things that were happening were standard capitalism in America.
It just makes me think, like, if we would have just let the midwives midwife, would we have even better technology today? Even better outcomes, even better rates of maternal mortality and infant mortality if we wouldn't have had these smear campaigns against midwives, and we would have continued to have the invention of technology and more studies.
You know, the stigmas that were created against midwives are still alive today.
Oh, for sure.
When I tell people I had midwifery care, they think I had some
like witchy
witch, you know, who knows nothing about birth. And I think about what you just said all the time, because why, you know, obstetrics has such a key important role in birth.
Of course.
And so does midwifery care. And now we're working so hard in America to bring them together. And San Diego is a prime example, because now there's more midwives practicing in the hospitals. They are assigned to the low risk women. If you are high risk, you go to an OB. If we had done that all the way back then, what would the maternal stats be in America today?
Right. But the pendulum has swung, and it goes back to something else that we were talking about, which is like, why does it have to be or? Why did it have to be or?
Because of racism and sexism.
Yeah.
It's so...
And capitalism.
It's so plain and simple. And capitalism.
Right.
Right.
Which is just depressing, because it's at the detriment of women. All of the women who died and were experimented on and who suffered for what?
Correct. So in the early 1900s, 50% of births were still attended by midwives.
Okay.
And this is really when the shift happened from home to hospital. So it's very interesting, because in today's climate, I feel like that's not spoken about enough. It's like, oh, people are giving birth at home. That's so crazy. And it's like, well, actually.
So radical.
Yeah, not that long ago, most births were at home.
Right.
Which is, it's just so intriguing to me. And then people argue the safety factor. And it's like, well, that's because the high risk women weren't getting the care they needed.
Right.
And now they are in the hospital. So those rates are improving. But what about the low risk women who were doing quite well in that day and age and now are maybe being a little over medicalized?
Right.
So
yeah,
that's the interesting dialogue there.
Very interesting to
very
think about, because again, it's not or, it's and.
Yeah.
Maybe low risk women should not be over medicalized because we're swinging the pendulum the wrong way
and
in their
they
stats.
deserve to have someone who is trained in low risk birth.
Right.
Which we're losing.
Right.
So there's a very interesting study about, specifically someone asked, how did twins used to be born? Were they born vaginally? First of all, the answer is yes.
Yeah.
They were born vaginally. And midwives were extensively trained in that because that was the only way. Cesarean was not safe yet.
Right.
So that wasn't happening. What's interesting is there was a study done in Turkey where obstetrics, we are losing the art of knowing and being trained in how to deliver twins vaginally.
Or breech.
Or
too.
breech.
Right. And
yes,
breech.
And breech.
Yeah.
So now we are training in the cesarean.
More heavily.
Yes.
Which makes sense looking at the rates of cesarean, right?
Right.
That's what you're trained in. That's your expertise.
Yes.
So when something goes wrong, we go straight to cesarean.
OBs are surgeons.
Yeah.
Yeah.
Right.
They are really specialized in
Of course. And that is amazing.
Yes.
And also, that is a specialty.
Yes.
So then, to your point, maybe that should be for high risk versus low risk, maybe is being over medicalized.
The OB I went to, he does vaginal twin births. And the reviews I read made me cry of the women who found him, because a lot of people won't.
Yeah.
Will refuse because they simply just don't have the training in it.
Yeah, of course. And that makes sense. My husband has twin sisters. The sisters were born in 1990. Twins, carried to 39 and 6.
Wow.
which is no longer recommended, right? The recommendation,
Right.
I think, is around 37 weeks for twins. They were both born at about 5.5 pounds.
Wow.
Vaginal, spontaneous, unmedicated birth.
God bless her.
Yeah, God bless her. God bless her. And
God
also,
bless all twin moms.
right. And also, it's just possible, but we are meant to think that that's not possible and it's not normal. And it's just very interesting because 1990, that's not that long ago.
Right. Yeah. Wild.
Okay, so let's really quick talk about pain relief, because obviously back in the day there were tinctures, there were other types of pain relief, right, that midwives and doulas and friends would recommend. Then we get into medicalized birth, and there's technology in pain relief. And we're in the 1900s now, and there is a boom in technology around pain relief in childbirth.
Yes. And it's women led. Women want this, which makes sense. It fucking hurts.
Right.
Like, hello, I'd be out there on the streets.
Totally. Because it should be an option. But
Yes.
let's talk about why it wasn't an option.
Did you know that
Probably not.
a lot of rhetoric surrounding birth having to do with religion, the mindset was that childbirth is supposed to be painful and women are supposed to suffer.
Right, because of Adam and Eve.
Yes.
Well, if you've watched The Crown, you've seen it, because they do. Did you watch The Crown? Once Queen Victoria used pain relief during childbirth.
Chloroform.
Chloroform is an industrial solvent, which back in the 1850s was used as a anesthetic. Inhaled, like, so you put it on a rag or something and then you inhale it. It's basically a pre-industrial revolution beta blocker. Literally. So it would attach to the GABA receptors and basically act as a beta blocker. Your body isn't going into that fight or flight response. Even though there's still pain, it's just not as like chaotic.
Yeah.
So once Queen Victoria used it in childbirth.
She used it on her 8th child. So to be fair, she didn't use it for the first 7.
Right.
And then she was like, I'm over this shit.
Yeah, because 1847, there was a Scottish physician who started using it. And then Queen Victoria was like,
sign me up.
Which, fair enough.
And religion, the religious
aspect.
Folks.
Yeah.
Religious leaders back then and the church in general was like, no.
Right.
And then when she used it, it was like, yes. So it shows how culture and religion and feminist movements and all these different things impact birth. It's not just what's proven to work or what's in the studies. It's like all of these different things.
Right. Which in my mind brings me to Posh Spice and her cesarean.
Oh my God. Tell me what.
So when she had her cesarean, her baby was breech, and she had a scheduled C-section. And all of the articles, after I looked it up, there were over 335 articles that used the term too posh to push, right? Because Victoria Beckham was Posh Spice. Too posh to push.
Oh my God.
And in her documentary recently, she talks about, like, I wasn't too posh to push. I just had a breech baby, and I was told it was unsafe.
Medical complication.
Yeah, I was told it was unsafe to have a vaginal delivery.
Right.
So C-sections were already on the rise in the UK. In the 1950s, C-sections were about 3% of births. Then in 1980, up to 9%. Victoria had her son in 1999. And they were over 20% of births by 2000. So we can't say that was the cause of the rise of C-sections, but there is discourse on the internet about how these articles, as you were saying, like, social trends affect birth, right? And it's not all just evidence-based. There's movements and there's culture and there's all of these things that affect it. It's just so interesting because obviously C-sections are necessary and they like, thank God for them. They save lives. Yeah. But it's just so interesting that people took this medical procedure that was recommended to Victoria Beckham by her doctors, and they said she's too posh to push. And in addition to C-sections already being on the rise, there was a explosion, and it was between 2000 and 2011 where there were 335 articles written citing too posh to push. And now the C-section rate in the UK, in England, the C-section rate is now 42% of all births. And it's just very interesting.
That's crazy.
It's very interesting to think that Victoria Beckham's breech scheduled C-section may have influenced culture in the UK. It's just very interesting how these things may possibly have a hand in medical decisions.
Right.
So another thing that was affected by culture is the feminist movement around pain relief in birth.
Yes.
Which, like we said, fair enough. But then came twilight sleep.
I think a really big theme to kick it off is people wanting something, and then the research comes out and we're like, whoa, let's try to reverse this.
Yes. The pendulum swings too
the
far.
pendulum swings
and
too
we're
far.
like, let's go back to the middle, which I feel like would be the answer to all of our problems in the world.
Right. And this, is the case for electronic fetal monitoring, for
Yes.
forceps, for episiotomies, for all of the different interventions in birth. Is like we got to a point where the research caught up and we were like, whoa, these are necessary, but like not this much.
Slow down.
Slow down.
Yes.
Have you seen the photos of twilight sleep?
Unfortunately, yes.
I'm going to put one up right here.
Yeah.
It is crazy. Women fought for this in the streets.
Right.
Fought for this. And to be fair, some women who had it documented once they knew what had happened were like, I still am glad I did it.
Right.
Which,
like, fair enough.
Totally.
It just goes back to our argument where there's a informed consent, right? Like,
yes.
and birth feeling
Well,
like it's being done to you versus
yes.
you being an active participant.
Well, also, those women actually don't really know what happened because...
Right.
So twilight sleep was morphine plus galopamine.
Which causes amnesia and sedation.
Women...
So pain relief plus amnesia and sedation. So women were literally not there.
Not there.
Not there.
Not just that, but could not control themselves physically, were thrashing, screaming, had to be blindfolded, had to be restrained. They are in legit straitjackets.
Yeah.
With blindfolds.
I've seen the cuffs around arms and ankles.
In New York City, a lot of the offices surrounding maternity wards were filing complaints because they heard so much excessive screaming.
In New York City, too. It's not a quiet place.
In New York City.
Yikes.
So... And this was in the 1900s. This was not that long ago. It was invented in the early 1900s. Women were marching in the street for it. Like we said, fair. Childbirth is very painful. It starts to get used a lot.
In 1915, a woman was in childbirth with her third child, a big advocate of twilight sleep, and she died. And her husband and her doctor denied any correlation between her death and twilight sleep. But then... obviously that was scary, and so it started to fall out of popularity.
Yeah, and so again, it's like a social movement started it being widely used, and then a social movement against it starts swinging the pendulum. And also correlations, causation started coming out. Neonatal distress, babies were being born limp, not able to breathe well. All of the different drugs were crossing through the placenta, all of these different things.
Causing issues for baby.
Yes.
And then not to mention that women were physically restrained during this process. It's not that they didn't feel pain. They were physically tied down, and so after birth women were having injuries like burns from the restraints. And
crazy, like a horror film.
Yeah, it seemed like this amazing invention, and people were like, yeah, painless childbirth. There was a book written about it. There were not only rallies in the street but associations made to advocate for it. And then the fallout. There
was also more injuries because more forceps were used, more
interventions,
prolonged labor, all of those
because
things.
You're tied down.
Well, yeah, talk about limited movement. We have all these studies now that show you should be moving and all.
And you're tied down,
all goes back
with
to like
mittens on so you don't hurt yourself. Like it's crazy.
Like,
blindfolded.
Why did medical inventions and improvements, instead of just improving the things they were supposed to improve, it's like we just started using them for every single birth.
Right.
And so women used to move in labor, used to have doulas, used to have midwives, all these things. And now it's like all these studies are coming out that are like, oh, birth can be a lot more simple and we can go back to how it was done before for low risk women.
Right.
It's
and
wild.
Every new thing, comes out and then we're like, we jump on the bandwagon. We, as in society, jumps on the bandwagon. It sounds like this amazing. I'm sorry, but if it seems too good to be true, it probably is. Like, that's what you learn as a woman in your 30s.
It just makes you think what will come out in 30 years about things that are in practice now. And I do think it's worth mentioning that is already happening. Right. So electronic fetal monitoring, it's like studies had shown years ago that this was not preferred for low risk women.
Right. Not evidence-based recommendation.
Yes.
It was not an evidence-based recommendation for low risk women to have continuous electronic fetal monitoring. You know what happens? Yes. You go into the hospital and you get electronic fetal monitoring. And
I did not have the epidural, none of those things that more required when you have those things.
Right.
And I still could not push back on that.
Right. Yeah.
Yeah. Another good example. Episiotomies. They were routinely used, and now it is known that even a second degree tear vaginally is preferred over using episiotomies that cut through the tissue and are far. I mean, my mom had an episiotomy. It's still a life-saving procedure sometimes.
It can be when used in an evidence-based
but you start to realize those evidence-based ways, and when it is preferred, it's a small percentage.
Right.
And the medical literature is the one who says that.
Right. Not us. We are literally reading.
No longer routinely recommended at all.
Reading and then regurgitating here.
I mean, my OB literally was like, I don't perform episiotomies. There are 70 other things I do before that.
Right.
Because of the data.
Well, because that's what ACOG says.
Because it's damaging.
It's damaging, and there's 70 other things to do before you do that, and usually one of those works before you get to that point.
He was like, there are hands-on maneuvers, there are things to do that will improve everything
before. That's why it's so important to have a care team who's educated in across the board, because if your provider is not educated in those maneuvers, then of course they can't do those maneuvers.
One more to bring up on that same subject that we've spoken about before, but I'm sorry, I'm a repetitive parrot because it's not spoken about enough, is why we are still routinely recommended to be on our backs during birth. It is an exhausting conversation because it is shown time and time again with research, especially for unmedicated women, that this is not the preferred position.
Well, I would argue that medicated women too.
I know.
Even medicated, the preferred positions, I mean, correct me if I'm wrong, are side lying, squatting. I mean, I understand like you can't always get
hands
into
and
squatting,
knees.
But hands and knees, I was on my hands and knees and I was fully unaware of my legs with my epidural. The nurses were amazing. They got me on hands and knees. They were like, because my baby was sunny side up, they were like, let's flip this baby.
Yes. That's why who you get at birth matters, because they are practicing with evidence-based current modern
guidelines,
techniques.
Which
evidence. By the way, are techniques that have been utilized by midwives for centuries.
Right. Since
the
dawn of time.
And now we are like, wait, let's go back.
We're like, wait, I have this really good idea. Get on your hands and knees. It's like, thanks. Which great idea. Who thought? No, but it's crazy because the history of being on your back is actually like a perverted and disgusting practice of when this king, right? And there's like discourse and debate around the how this all began, but there is a story that circulates, and this was in the 1700s or maybe earlier. There was a king who liked to watch. He got off on women giving birth, and so he wanted women to be on their backs because it was the best view for him. And to be fair, I understand that it would be the best view for doctors.
Yes, although
easiest way to see everything going
correct.
On.
Easiest
for them. And although the arguably worst position to be in as a woman who's actually birthing.
Yes.
Like, so I can't think of a worse position.
I think easiest, but not safest.
Right.
My OB was very clear. Like, you are going to be in whatever position is best for you and the baby. And I can work around it. It is harder for me, but I will do it because it's actually safer.
And
I have to work harder. Makes my job harder. harder. But
Right.
your safety matters. And I know.
And your comfort.
And your comfort matters.
And it's evidence-based that moving around
Yes.
and getting in different positions helps.
Well, and comfort makes it safer.
Yes.
And that's what people like don't understand is that comfort and oxytocin and getting all these hormones going makes birth progress and makes it safer.
Right. And as soon as you intervene
Yes.
in that way and tell a woman she has to stay on her back.
Oh, I was panicking. I was on my back, and then he came in and he was like, oh, let's move you into a different, I was like, for the cervical check, I was panicking because it hurt so bad.
Well, and also because that's a very uncomfortable position to be in.
Insanely uncomfortable.
So it just goes back to like, who is this about? Is it about the king's viewing pleasure? Is it about the doctor, it being easiest on the doctor? I understand when you have an epidural, like you got to be in the bed mostly, you know, because like you can't feel your legs.
Use a peanut ball.
Use a peanut. It's just crazy to think about the history of that and why that is. I mean, people just get right on into that position. You just laid on down. It's crazy.
It is crazy.
I mean, don't get me wrong. As a girl who loves to sit and lay down, I also would love to lay down.
Ain't no way I was going to lay down. Holy shit.
No, I mean, I didn't even want to lay down when I was medicated because it just, even though you're not in pain, it still feels weird.
Show me an animal in the wild who is in bright lights with random people they don't know surrounding them.
Poking and prodding,
laying flat on their back like this, giving birth.
Right.
Show me one. Show me a mammal.
That there's another interesting.
We are animals.
Right.
If anyone forgot, we are animals.
I know. We like to think we're so civilized. We're not. We give birth just like the rest of them. The other crazy thing about animals is that like other mammals don't need help giving birth.
Yes.
Like we need help, or do we not?
We do.
We do.
We do need help.
I wonder about dolphins because I feel like dolphins are sort of like us.
Women weren't like giving birth YOLO back in the day alone.
Right.
There's always been midwives. There's always been people with knowledge helping. And I'm such an advocate for that. And I don't know what I would have done without my midwives or my OB. So the free birth movement like really pisses me off.
Yeah. It's scary because
it's really scary.
Like I understand wanting to give birth at home or wanting to give birth where you want to give birth, but like shouldn't you have like a buddy system? Like at least like one.
Yeah.
One buddy.
Mean, people forget that giving birth at home with a midwives are professionals.
Like
they are extensively trained.
Medically trained professionals.
They are not like a little witch in a cave. Like people really are still using the rhetoric that was used against them in the early 1900s.
Do you know where that stems from? It stems from the Catholic Church. Because they were like, they're witches. Because they couldn't understand their, like how they healed people. And they were like, they're not part of the church, so they must be witches. We could talk about the Salem witch trials another day. I would like to poll the class. Have you watched Call the Midwife?
Oh my God, the amount of people who have told me to watch this, including my mom, and I have not.
I can't believe you haven't watched it.
I know.
They talk about birth history, and it's a very amazing show. I couldn't watch it when I was pregnant because it gave me anxiety. But I recommend that you watch it now. The show is based in the UK, and they talk about thalidomide and the horror stories, right? Thalidomide was given to women for morning sickness in pregnancy, and it is a international.
Was it just because I don't really know the history on this that much. Was it just, it's here, let's use it, or were there any studies at the time?
So it was widely used in mostly the UK, Europe, and Canada. And it was prescribed for sleep issues and morning sickness in pregnancy. Someone who worked at the FDA who refused to approve it in the US before there were more studies on it. And unfortunately, there was a wave of like 10,000 births. Babies were born malformed, severe limb malformations, missing limbs. And it wasn't ever approved in the US. Praised Frances Kelsey.
Snaps to Frances Kelsey.
A woman.
Snaps to women. It's always the women.
It's always the women. So this issue, this horror, changed how testing and recommendations for medications in pregnancy, the complete landscape changed.
Now it's very, very minimalist.
Because it's unethical to test things on pregnant women.
Yes.
It's unethical. And we are not going to say try it because it's not worth the risk.
Totally.
And so now medications have to be deemed safe and effective in pregnancy before they can be recommended at all, which didn't used to be the case. And this didn't happen until 1962.
Wow. And now the most widely tested and effective method of morning sickness is obviously Unisom. Like the studies are
Unisom with B6, the combination.
Yes.
But like for someone like me who had hyperemesis gravidarum in their pregnancy,
right,
it just makes me think like I'm so lucky to have been born when I was born, because who knows what would have been the recommendation back then. And my grandma actually took something. This is on my dad's side. My dad was born with a clubfoot and his teeth were completely gray. Never had white teeth.
Whoa.
And the doctors said that it was because of that drug. I don't know what the drug was. He was in leg braces through baby and toddlerhood for his clubfoot. And
whoa,
his teeth never were white.
Whoa.
And yeah, so it's just interesting. Like that was, my dad was born in 1961.
Wow. Okay. So now we're in the mid 1900s.
Yeah.
And this is a really interesting time for childbirth because now the pendulum is swinging back. Women are starting to really look at the history we've described so far and be like, whoa, wait a second.
Right.
This is a new age of feminism. We want control over our bodies again. Dr. Lamaze, who is a French doctor, started the Lamaze natural childbirth movement. A lot of people back then were reading Childbirth Without Fear, including my grandma. So she was a part of this movement. And she could not find an OB that would allow her to attempt a natural birth. At this time, she had to go to a military hospital. She was not military. At that hospital, they were allowing women to give birth naturally. So she had all four of her daughters unmedicated.
Yeah.
And that was like just starting to be heard of at the time. It really was not heard of. This is the era coming off of Twilight sleep. So now the natural childbirth movement is happening. ACOG is starting to push back. There's a lot of clash happening between these movements. Nowadays, you see a lot of partnership between these movements because World Health Organization, all these different organizations, including ACOG, are starting to have a reckoning and recognize, okay, you know what? If we hold hands with each other,
thank you,
things get done.
Thank you. Let's stop fighting and say maybe it's an and.
Yeah. And let's say that maybe we are the experts for high-risk women and women who need these tools and want these tools. And then maybe midwives and people within the natural childbirth movement are the correct people for low-risk women or women who just want to explore that.
Right.
Like, let's give women a choice again.
Right.
You know?
Right. It goes back to the formula marketing and
Yes.
taking away informed consent. And
Yes.
it's like, look, formula should exist. It's life-saving and no one should feel bad about using it. But making women go back to work at 3, 4, 5, 6 weeks, that doesn't give women a choice. And
Right.
the insane predatory marketing of formula undermines informed consent of what breastfeeding and what formula is. So enough. I
feel like a trend of this episode is that medical practice takes a while to catch up. A good example of this, which we talked about a little bit, are episiotomies. And I want to just show with clear data what has happened throughout history. So in 2000s, 33% of vaginal births involved episiotomy.
In the year 2000?
In the year 2000.
Holy
2012 dropped to 12% following a guideline change. The research was available long before 2006. Practice lagged the evidence by years. This is all sourced by ACOG.
Wow.
So I just want people to realize there are no villains here, right?
Yeah.
But it's
the
so
man
important.
with the chainsaw comes to mind.
People love to bash birth plans. They love to bash. Educate yourself. Inform yourself. Doctors are the know-all. You can't use your own research, blah, 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 blah. But, and there is research and medical advice is lagging. Training is behind. And there is a reason for these movements.
Right.
And I just think that, this discourse gets so villainized and
Yeah.
birth plans get so villainized. And there's been clear data, by the way, that I showed you recently where birth plans are actually improving changes.
Right.
And it is shown that if you have a birth plan and you just know the ways to have discourse with your OB and have discourse with your medical team,
Right.
you
Discourse,
are
conversations.
more likely to be satisfied with your birth.
Right.
Those are clear data points.
Right. I think what happens is that the extremists are always the loudest, right?
Yeah.
And so what happens with these conversations about like do your own research and birth plans, same thing, is that when the pendulum swings so far to the extremists, those people are the loudest, right?
Yes.
And they say it the most. And it's not that they are always wrong. And I think the solution in this situation is like have a birth plan that is like, as you talked about, that you're working on for everybody here, is that we are informed on the interventions, what happens, the history, and then you're able to make decisions based on what happens during your birth. Not saying like, I want to go in and decorate my room so that it's pretty for Instagram.
Or like I'm going to go in and boss around the doctor.
Right.
Because that's the
right. It's not
stigma.
It's not about that.
Yeah.
And it's not about decorating for Instagram, right? It's about having informed consent and
having body rights, body autonomy.
and having things
your life is in their hands.
right, and not having things done to you, but being part of a team.
Yes.
Because it is your body and it is your baby.
And because look throughout history how much our bodies have been experimented on.
Right.
And how often it didn't work out for
Right.
women and how much has changed and improved.
Yeah.
Another example of something that was invented, which we talked about a little before in this episode. And then it was invented and then it was supposed to be life-saving for very high-risk people. And then it became widely used is the C-section.
Right.
The first recorded successful U.S. C-section, 1794.
Successful in, what does that mean?
So before then, it was on women who had passed away in childbirth.
Okay, that makes
so
sense.
this is thought to be the first recorded live successful.
Oh.
Yes.
I don't even want to know the details of that.
Well, so
That was for before pain relief.
some historians dispute the details of Bennett's background, but this is widely reported.
Okay.
So Elizabeth Bennett was in life-threatening obstructed labor. Dr. Humphreys refuses to act and leaves. Jessie Bennett operates on a planks and barrels table, delivers baby Maria, also removes Elizabeth's ovaries. Both survive. Jessie reports it publicly in 1892.
Yikes.
First official documented U.S. C-section was later in 1827.
Okay.
And this was in a backwoods cabin in Newton, Ohio. Patient had severe pelvic deformity, seizures during 30 hours of labor.
Oh. And this is why these things need to be trained on.
100%.
They need to be an option, and
Yes.
people need to be educated on them, their options, and obstetricians need to know how to perform them. They exist for a reason.
Correct. Crazy stories. Rates now in America are around 30%, differs per hospital, but around that there.
On average.
And World Health Organization states it should be more around 10, 15,
Right.
something around that ballpark. So it far exceeds what it should be. And there are so many factors, right, that
Of
go
course.
into that.
Of course.
And that's why birth studies these days, it's very hard because there's so many things that go into it.
Well,
so many
similar-
different interventions that are happening at the same time.
Similar
so you
to
don't,
breastfeeding.
Yes.
It's hard to extrapolate one data point and then
Yes.
say causation
right.
because there's so many factors.
There's so many factors.
Yeah.
But, you know, it's just another interesting conversation about how did we get here? How is this being used so much and why?
Something that I want to talk about, and this is probably not the time for it, but like, why should you give a fuck if you have a C-section or not? And I don't think people know the answer to that.
Yeah.
Like, why should you care?
There's a reason why the World Health Organization states it should be around 10 to 15% instead, because there are a lot of risks associated with it. I mean, it's a major abdominal surgery. So to answer you, like, why should you not want to have a major abdominal surgery?
Right.
What's interesting is this was floating around even when we were younger. Some of my friends would be like, I want a C-section because I don't want my vagina to go to shreds for sex.
Right.
Myth.
Right. It's a muscle.
It's a muscle. And also, can we talk about the dad stitch?
Right.
Another thing that was done to women and sometimes was done without their knowledge.
Yeah. And it used to be a funny thing that the husband would say to the doctor, put an extra stitch in. And it's crazy because like that doesn't actually move the needle on like what they think it is doing.
Right.
Because it's just an extra stitch at the opening. Right. So like, let's talk about what's happening internally. Also, there are a ton of women on TikTok who talk about their stitches from either episiotomies or tears and that they feel like they got the husband stitch or they know they did these days. And they're like, I am in chronic pain because of it. And they're like fighting in the streets.
God, crazy husband stitch. You can't make this shit up.
No, I wish I could.
Everything in this episode follows an arc. Something is medically introduced in the history of birth. It is rejected and then it is embraced. And then research comes out. And then everyone goes, no. And then everyone backtracks. Data comes out. Things change. These stories are not meant to say, let's distrust medicine. It's meant to say, let's engage with it. Let's talk about it. Let's talk about these studies. Things are constantly changing.
Right.
And that is the natural arc. And so things that are in practice today might not be in practice in 10 years.
It's crazy to think about like what in 30 years we'll think is barbaric that we are doing
Maybe
today.
the OdonAssist. I just want people to know some key resources that they can look to for evidence.
Ooh, that's smart.
As a good way to wrap this up like a little present.
Love it.
So I'm a huge fan of evidence-based birth. She only pulls from studies. She's a PhD in RN.
Okay.
And her whole mission in life is evidence-based birth, which she actually has a podcast too.
Cool.
She also has a book called Babies Are Not Pizzas, They Are Born, Not Delivered. It's a really good book, and it's all about studies and discussing them and talks about birth history and how things have changed. Her views are very aligned with World Health Organization. So lots of parallels there because they're just looking at studies. And then obviously CDC and ACOG. And I like looking at the ACOG opinions. Because what they do is they look at data and voice opinions. It is very interesting.
Oh, that's cool. I didn't know that existed.
Yeah.
Cool.
So there's ACOG opinions on episiotomies, on all these different things. Very intriguing.
Very interesting.
So I like to look at all of those different things and combine them and then, do your thing.
Totally.
Proceed as you wish.
Right. That's where the data is.
That's where the data is.
And just by the way, that's where we are getting our data.
Yeah.
Like we're not just like willy-nilly.
No. And
it's not opinion. We're just literally reading science.
And my certification with Lamaze for childbirth education is all evidence-based.
Right.
It's all evidence-based. Like I'm not going to teach something that's not true.
Right.
Scary.
Scary to think that people would.
So knowing this history means that you can spot when you are being handed evidence versus tradition. So that's what my ideal birth plan would be. Is you are looking at all the evidence and you are like, look, I would rather ditch these traditions and do what should be in practice today.
Right. Instead of saying this is what we've always done.
Yeah.
We're saying do what the evidence says.
Yes. So anyway, I hope you found this valuable. I really am working on a birth packet and template. It's just taking me 8 eons.
Taylor is working so hard on
because I care. That's taking your girl a while.
Well, you're a little busy, but that's why it's a work in progress, is because like Taylor's not making just like a 1-page like cute fill out like check this box. Like she's making it should really be called a packet or like arguably a book.
Right. So, but it will not replace a birth class.
Right.
And I really want people to do that if you are able.
Yes. It will be work in conjunction with a birth class.
And all the sources are the ones that I just mentioned. I'm just consolidating it for you.
Right. So next up, we are going to play a mom talk.
Yes.
Hi all, I'm Kata from Hungary, and my story is about my experience of giving birth for the very first time, and more specifically a moment where I felt real awkward. So I was in labor for hours at that point, and a small piece of my cervix left there somehow, and the doctors were trying to remove it during every contraction. And it was really bad, really painful. I actually threw up on my husband's leg, so you can imagine it. But fortunately, after this incident, they just let me handle the contractions until one point where one of the doctors was trying again to get in, and when she reached my vagina, I immediately, by reflex, slapped her hands. So I just slapped her hand like she was pickpocketing, and I felt real awkward at that moment, and I immediately apologized for that. So I'm just curious if anyone else has the same experience as me or happened the same as to me. Anyway, thank you girls that you are sharing your experiences and knowledge. It's fun, it's educational, and keep it that good. Bye.
From Hungary.
Oh my gosh, so
I
cool.
love
Hi to Hungary.
Yeah, hi to Hungary. That's so cool. Oh my God, been there, done that.
Sounds the same as what you just went through with your birth.
Yeah, with the cervical checks.
Yeah.
I feel like it's not spoken about enough how some people, I feel like it's like la da 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 da, it doesn't hurt.
That was me.
It was excruciating.
So like for me, I never even like noticed.
Well, you didn't have one, right? The second birth,
No,
because
I
there was no
did.
time.
She was like, let's get you on a bed and see where you're at. And she was like, oh, you're 6 centimeters. We need to get you over to labor and delivery. And then as soon as we got in the door, my water broke and the baby was out.
Wow. So fun fact, I have never known what my dilation was for
Crazy.
either pregnancy.
I'm such a nerd.
Neither. I'm like huh?
Yeah.
Yeah.
I'm such a nerd. I'm like, how dilated am I?
Yeah. Even though it's.
Like, I know. But I never had a cervical check in my second pregnancy. I declined them.
Yes.
Because I was like, literally, don't get my hopes up.
I actually was offered one in pregnancy the second time.
Yeah.
And I was like, you know what? Maybe hurt too bad.
Oh, yeah, you tried.
So something about it was just really sensitive for me.
Yeah.
And
Didn't you say that your GBS test hurt really bad?
Yes.
Yes. Which is
Hot
crazy because
take. Anyone else experience that? I don't know.
It must be like different people have different things going on.
Oh my God. It was excruciating.
I was like,
cervical checks, GBS swab, it all was excruciating.
I guess I just have like a really strong vagina.
Cervix.
I'm just kidding.
Okay. Do not be embarrassed that this happened to you.
Also, if someone is reaching
I
up
swatted
there,
people away verbally.
yeah. If someone,
I didn't physically swat anyone, but I was like, ain't no way you're coming near my cervix.
Totally. If someone's trying to reach up there without first saying, okay, like you're going to feel pressure or okay, I'm doing XYZ, they should be prepared to be slapped.
Oh, that is such a good take because my midwives were very good at that. And to be fair, my nurses and OB were also very good at that this time around. Like, do you mind if we do this? We want to do this. And I was just like, yes, I mind.
Right.
But they did ask.
Right.
And the fact that it kind of sounds like that wasn't happening with you is alarming.
It sounded like, like the part of the cervix was stuck. And I had a friend who had to have a procedure done to remove part of her cervix because something was going on with it, or like they try to push it out of the way. So I would imagine that's very painful. It sounds like it was.
All is fair in
labor and delivery.
All is fair. It is. I'm sorry. Reflex swatting.
It's primal. I mean,
primal.
And there's no shame. Like truly, it's like the time of your life where you are so, your mind is on a different plane. And yes, someone's trying to reach in there. Excuse me, move your hands.
My mom was my doula, my first birth. And she kept giving me advice. And I lost it, even though I hired her as my doula. I was losing it. And afterwards, I was like, I'm really sorry that I was raising my voice at you. And she said, honey, don't ever apologize for something you say during childbirth.
Right.
And it stuck with me because I was like, you're right. Why am I apologizing? I was in the depths of hell.
Right. And like, get your mitts off of me.
And you did apologize. So bless your heart.
You weren't the first. And you most certainly won't be the last.
Yes.
So I think when you think about it in that lens, it's like, I will 99.99% guarantee you that the person who tried to touch you does not remember this. So I wouldn't even think about it again.
Totally.
Yeah. And congratulations on your new baby.
Yeah, congratulations.
And congratulations on your birth.
Yeah.
And I think all is fair in
Labor and delivery. I love it.
That's it for the show today.
Yep. Thank you all so much for listening.
Yep. And we will see you next Thursday.
On the couch.
Bye.
Bye. Thanks for hanging out with us today on the couch.
If you love this episode, and we know you did, make sure to follow Moms Interrupted on Spotify, Apple Podcasts, or YouTube so you never miss an episode.
And if you have 2 seconds, rate us 5 stars. It helps more moms find the show.
And helps us keep growing this thing without charging moms.
Yay for moms! Share this episode with a friend, your group chat, or any mom who needs it.
We'll see you next Thursday on the couch.